When we think about human rights and the fact that all people are equal, we start to reflect on the fact that people with mental health conditions have historically been stigmatized. I think as professionals and as people trained in mental health care, our work is fundamentally about human rights.
I knew him my whole professional life, actually. Dr. Pierce started a group called the Black Psychiatrists of America as a founding member in 1969. And you see some of the same challenges that he was involved in then.
When I joined Boston Medical Center, I connected with colleagues in South Africa. We decided to start the Africa Global Mental Health Institute. That really began the process of moving Chet's vision forward.
I want people to know that there is no health without mental health. People with mental health conditions have their rights that has to be protected. They have to be respected. Stigma is a barrier to care. It prevents people from seeking help. It not only affects the service users, but even the service providers.
This stigma about the mental health workers, and then they say you behave like your patients. So as a result, people don't go for care, and young doctors don't go for training.
People don't get services. One, there's stigma, but two, there are very few specialists in this area. By the time they get to the hospital setting, time has passed. The illness has taken months or sometimes years, because initially people are not getting into the psychiatry field. But when they come here and they say, hey, we are from all over the world, we are talking about mental health, they get excited and they will go and tell other people. Then we can have more young people getting into training.
A lot of the work that we are thinking about is how do we innovatively get to these population groups that are far removed from the traditional settings of hospitals or urban settings or universities.
If somebody can say, hey, I know where to take you, I know you can get care, then that is going to help many people who are deep in the rural communities and are not accessing these services.
Integrating traditional, spiritual and modern medicine is not a contradiction, but it's complementary.
So for me, I think training, and the more psychiatrists we have, the more we can talk about mental illness, the more we can talk about mental health, the more people can access care.
I'm very hopeful, because if I look back where we have come from, we have been able to change the narrative of mental health.
I think we're at a better place now than we were when Dr. Pierce started his Black Psychiatrists of America. He was always projecting to the future. In the back of your mind, he's always an encouragement.